we have to count on Health Canada and the Minister of Health to be able to stand up in the face of what's really, call it what it is. It's bullying. It's trying to force them to do something that's not in the interest of Canadians. And I've got great sympathy for the people at Health Canada who are trying to adhere to the science. They're trying to look at facts. They're looking at what's happening with consumers. They're doing research to find out how can we improve the legislation we've got? How do we deal with the regulatory powers that we've been granted in order to try to refine this, to reduce the risks that are associated with any new product while getting the benefits, getting rid of cigarettes. We need to have rational discussion. We need to look at risks and benefits. We need to actually consider facts. And when you have people talking about all the downsides they see on vaping, and with any new technology, anything, there's going to be downsides. We've got to measure them, look at what we're accomplishing, and look at how do we control for any unintended consequences. You don't simply throw it out when you know what the alternative is, because the alternative is that 100 deaths a day from cigarette smoking. We should look at actual facts, what's going on. We should be medical detectives. That's what you do in public health. Look for information from every source that you can get it. And that we have people who are not looking at how many people have been going to vape shops and quitting smoking, where they're not looking at what's happened to cigarette sales in Canada or the States or other countries, how much more rapidly they've gone down when vaping became available. I think if you have appropriate regulatory oversight, if we have reasonable legislatures who are passing laws that make sense, that meet market needs, that work with human nature. I mean, look what we did with laws on sanitary food, on science-based pharmaceutical products. Look what we managed to accomplish with things like auto safety. We've reduced the death rate per mile driven by over 80% since the time I was a teenager.